Welcome to the 275th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today, I welcome Mallory Keitake, artist in residence with the Community Environmental Health Program at the University of New Mexico College of Pharmacy. Just a reminder, you can catch COVID calls live most weekdays at 5:30 p.m. Eastern Time and many Fridays at 5:30 p.m. Korea time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can also hear COVID calls anytime recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can keep up with COVID calls via Twitter using the handle @US of Disaster or @COVID calls. Please do help spread the word and send suggestions for future guests, future topics, and please feel free to suggest yourself as a future guest. Just want to underline that we're still getting really great suggestions from listeners for topics and people they'd like to hear from, and people suggesting themselves. We'll be continuing to schedule COVID calls for the foreseeable future, so please don't hesitate. As of today, May 11th, 2021, there are 3,306,038 deaths globally from COVID-19. That's according to the Johns Hopkins University Coronavirus Resource Center. The death toll in the United States from COVID-19 has now gone to 582,163 lives lost. In India, 250,025 people have died from COVID-19, and that's up from 246,146 deaths reported yesterday. Just staggering day-to-day totals coming from India at this time. As a way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic in some way, and I'd like to continue that now. The headline is Mansoor Ahtasham, writer who brought Bhopal to life, dies at 73. This was written by Catherine Q. Seeley and appeared May 8th in the Those We've Lost section of the New York Times. Much of the outside world, the city of Bhopal, India, lingers as an emblem of industrial disaster, the place where a 1984 toxic gas leak from a Union Carbide plant killed thousands of people instantly and up to 15,000 people over time. Mansoor Ahtasham, a Bhopal native who was one of the most significant contemporary voices in Hindi literature, showed his readers a far more complex place. To be sure, that disaster often hovers, metaphorically and otherwise, in his works. One of his most acclaimed books, The Tale of the Missing Man, which appeared in 1995, his alienated anti-hero was with a prostitute behind his wife's back on the night of the gas leak. But in Mr. Ahtasham's hands, Bhopal was a living presence, almost a character, whose changes and rich history he chronicled with forensic precision. He was a walker and city dweller, so his books are thick with description of the ever-changing contours of the landscape. Jason Grunnebaum, who with Ulrika Stark translated The Tale of the Missing Man into English, said in a phone interview. He had this almost magnifying glass of an eye, Mr. Grunnebaum added. If a cinema hall was raised or a new suburb was being built, he would describe these changes with a sensitivity, caring, and love as if it were part of his own corporal organism. Mr. Ahtasham died in Bhopal on April 26th. He was 73. Media reports said he died of the coronavirus, which has swept across the subcontinent with ferocity in recent weeks. His wife died of the virus in December, and his older brother died of it more recently. Mr. Ahtasham's survivors include 2 daughters and a younger brother. During 3 decades of writing fiction, Mr. Ahtasham raised important questions about Indian Muslim identity, about deteriorating Hindu-Muslim relations, and about the psychological aftershocks of the 1947 partition of India and Pakistan. In The Tale of the Missing Man, set in the years from 1960s to the 1990s, the specter of partition looms as a historical backdrop for its anti-hero, who suffers from a postmodern condition, a murky mix of alienation, guilt, and anxiety that cannot be diagnosed. Squibb in New York Magazine in 2007 hailed it as one of the world's best untranslated novels. It lost that distinction in 2018 when it was published in an English translation by Mr. Grunenbaum and Ms. Stark, who both teach in the Department of South Asian Languages and Civilizations at the University of Chicago. Mr. Atasham was especially taken with the translation, which received the Global Humanities Translation Prize. The English reincarnation of my novel is so moving, he told interviewers for the journal Public Seminar in 2018. It's stolen my heart from the Hindi original. Manzoor Atasham was born in Bhopal on April the 3rd, 1948, and raised in a middle-class Muslim family. He was educated at Aligarh Muslim University, in what is now the Maulana Azad National Institute of Technology in Bhopal. His parents wanted him to become an engineer. He tried for a few years, but his real passion was literature, and he soon abandoned engineering to write full-time. When his brother opened a furniture showroom in the late 1970s, he hired Manzoor to help manage it, which gave him a way to support himself while he wrote. He was fluent in Urdu, Hindi, and English, but wrote in Hindi, India's most widely spoken language, to reach the most readers. He also loved the theater and movies. Some of his works were dramatized. He landed a bit part in the 1994 Merchant Ivory film In Custody, about how Urdu, the language of northern India, was in danger of extinction as modernization obscured its contributions to Indian culture. The obituary of Manzoor Atasham, who died of COVID-19 in India last month. Okay, I'd like to turn to my conversation today. Really excited to introduce my guest to you. Let me do that now. Her name is Mallory Keitake. Mallory is from the rural pueblo of Zuni in western New Mexico. She's the mother of two and shares residence in both Albuquerque and Zuni Pueblo. She received her bachelor's degree in biology with a minor in art studio in the summer of 2009 from University of New Mexico, Albuquerque. She's currently the artist in residence with the Community Environmental Health Program at the University of New Mexico College of Pharmacy. Her work with the CEHP has focused on tailoring scientific concepts into culturally relatable art and graphics for Native American communities affected by abandoned uranium mines in the United States, specifically in the southwest region of the country. Her work has shifted recently into creating COVID-19 public service announcements and videos for Indigenous communities. Mallory, thank you so much for joining me on COVID Calls today.
Hi, thanks for having me.
Am I pronouncing your last name correctly?
Just about Quitauki.
Quetauki.
Yes.
Okay, thank you for that correction.
Oh, no problem.
So let's just start the way I usually do, just to find out where you're calling from and what the pandemic situation looks like there today.
Okay. I'm calling from home here in Albuquerque, New Mexico. The current situation we're in right now in New Mexico is actually kind of a good one. We are about 42% fully vaccinated in the state. About 53% have at least their first dose if they're taking either the Moderna or the Pfizer one. In Zuni, we have not had any positive cases of COVID. We've had one since April 15th, so our reservation has lifted some of its restrictions. We were closed down, we were shut down as a tribe. No outsiders were allowed to come in. We have suffered a loss of about 50 individuals from our community, and we have about 1,200 positive cases to date with over 1,000 recoveries. And that is just Zuni Pueblo itself within New Mexico.
And about the vaccination, how has that been working? Where are people getting vaccinated?
right now, the tribes are actually doing exceptionally well. The tribes are getting doses enough to cover the entire community plus more, and they're reaching out to surrounding communities, non-native communities, to start helping with rolling out the vaccine. The IHS facilities have been doing really good in reaching out and getting those vaccinations. I believe Navajo Nation has a really great number. They're at about 80% vaccinated. That's a really good number. I believe their population is in reaching the 200,000. So 80% is very good. Zuni, I believe we are at about 70% the last I heard, but it's still a good number. We are about 13,000 tribal members in Zuni right now. And like I said, tribally, they are doing really well in getting the vaccine out. There are drive-up vaccinations, the hospitals, and even here right now, you know, Walmart, Albertsons, the grocery stores are handing out vaccines on an appointment basis.
Well, that's really encouraging to hear that. And of course, with the recent news that 12 to 15-year-olds will also be vaccinated, that's going to increase that percentage probably too.
Yes, yes, absolutely. And the work has just begun to trying to reach out to that age group right now to make sure that we're making them aware that they can now be vaccinated.
So you mentioned there's about 13,000 people living there in Zuni Pueblo. I wonder if you wouldn't mind just offering some context, a little bit of the history of that community.
Yeah. So Zuni Pueblo is situated on the western border of New Mexico. It's about 150 miles west of Albuquerque, which is the largest city in New Mexico. Zuni Pueblo is one of 19 other pueblos. We are the largest both in population and landmass. We are about 450 acres, our reservation size right now. We have land holdings in several counties, Cibola, McKinley County, and parts of Arizona. And so, but we're all situated in one area of Zuni that traditionally we call Halonitiwana, which is the center place, the middle place. And we've been there since, you know, time immemorial. I believe they've calculated us to be there about 5,000 years, a little less than that. We were one of the first contacts from Spanish, from the Spaniards in about 1539. We had an encounter with one of the Moorish slaves that came into the village and, you know, announced themselves. And we had contact with Coronado's expedition, which, you know, in turn led to the Pueblo Revolt of 1680, where we tried to gain back our independence and gain back our right to practice our culture, our religion. And from dozens of other pueblos to the current day, we are left with 19. It was about 200 different pueblos in the 1500s before Spanish arrival. So Zuni Pueblo, we speak the Zuni language, which is a language isolate, and I believe it is partially due to our geographical isolation. We are in the high mountains of the Zuni Mountains, which range about 6,000 to 8,000 feet in altitude. So we're kind of high up there. We're also stuck in this little mountainous valley. Looks like a fortress from afar. It's a real nice place. Mesas everywhere. We have our own watershed. We have aquifers. It's like the perfect place to be, perfect place to grow up. Our school district is owned by the tribe, so a lot of our teachings are immersive. The kids are learning in both English and the Zuni language, and so we're a non-gaming tribe, so we don't have any resources that we're selling either. So we're kind of just trying to make sure that the culture and the ideals of our people are thriving and continuing forward right now in this new age. But we come from very old roots and very old traditions that we're trying to maintain and pass on to the younger generation.
Well, thank you for that description and for that history. And I hope everyone who doesn't know it now knows a little bit of it and can do some reading and follow up and learn even more. I remember in graduate school reading about the Pueblo Revolt and had never learned about it before at all, never heard of it. And it's an extraordinary history and really important, should be part of every curriculum that all students in the United States read. I wonder if you could tell me a little bit about the economic base there today.
Yeah, and Zuni Pueblo, and pretty much as it's always been probably since the early 1970s, but there was a arts and crafts boom around that time where Zuni silversmiths had an explosion of the desire for the artwork and for their jewelry. And at the same time, we had some of our older traditional art forms like pottery and weaving have a revitalization, and it became a source of income. So right now in Zuni Pueblo, it's a good size number, about 80, from last time I checked, it was like 80 to 85% of all households are, the main source of income comes from art. So cottage art, there's, multi-generational households with several family members that are making art as a form of income, whether it's jewelry, pottery, traditional art forms, painting, which is a little bit few and far, but the traditional arts, fetish carving are, before the pandemic, we definitely had a market for that in person with the different shows all over the country and in the Southwest. And I believe during the pandemic, a lot of artists have had to either seek other jobs or have stuck to online sales, which, is a little harder on such a rural place where internet access is still a little bit seedy. There's still dark spots within the reservation where some people have no access to the internet. So the arts colony took a really big hit during the pandemic, but I mean, when the jewelry boom happened in the 70s, it just really started out this, it was the way, it was every household, somebody's an artist.
I can't think of anywhere else in North America that I could imagine is like that. I mean, to grow up and say you're going to be an artist is, of course, something that a lot of families take with great pride, but it's not the norm. You're describing a community in which it's kind of considered normal that every family is going to have an artist in it.
Yeah, oh yeah, because it's, as I said, everything's immersive in Zuni. So even the cultural arts programs, they're taught from elementary to high school. In high school, they refine it for you to join the market and to actually make money off of the artwork that you're doing. And so you're taught, if you might not be from a like a pottery family, but you learn pottery in high school and you can, create your own legacy, as they say. Like I'm an artist, a painter and a potter, but my family line, they're all jewelers and I cannot do jewelry at all. I've tried and I've failed terribly. So a lot of what I learned is from my peers in school, and of course, my artistic parents. It has a lot to do with that too.
Well, we're going to talk about some of your specific artworks here in a little bit, and we're going to even show some. So people should look forward to that. But before we turn to that, let's talk about another part of your life and your work, and that has to do with public health. Can you set the stage for us a little bit in understanding some of the public health, how public health works there at Zuni Pueblo, how people get health access that they need, medical access that they need, but also some of the perhaps unique public health concerns that you have there?
Mhm. Yeah, so Zuni Pueblo, as I said, is a very rural town. The closest metropolis or closest city that has, like a Walmart or gas stations is still a good 30 minutes away. It's Gallup, New Mexico. It's the closest town. So a lot of the services that we have in the village, we do have a IHS facility, the Zuni Comprehensive Community Health Center. It is, I believe, a it offers a wide variety of services. Um, they have inpatient, they have lab, dental, a birthing center, pretty much everything you need for subacute care. Anything that needs more work or surgical procedures, patients are flown out to larger hospitals like here in Albuquerque, to UNM, Loveless, or Presbyterian. Sometimes they even get transferred to places like Gallup, RMCH, the Gallup Indian Medical Center. But Zuni, we do have our own little clinic where you can go and be seen for preventative health care. We have urgent care. We have an ER. And so a lot of, there are health disparities within the village, and there is an underutilization of these, what the hospital offers. I believe in part to a lot of it has to do with, historical trauma, economical issues, transportation, and something that not a lot of people might understand is the cultural and language barriers between patient and provider. And so that's been like the biggest mission for my work, is to recognize where these disparities happen and why they're happening and how do we help move it along. And, just through firsthand experience, family members, sick family members, and what they go through with the hospital. Sometimes you have hesitancy with people wanting to go to the hospital. And a lot of the hesitancy is because that idea of not being able to communicate what ails them, whether it's a pain threshold, pain level, or a symptom that they might be embarrassed with talking to a non Zuni physician. To this date, we still have no Zuni physicians that were, born and raised on a reservation that know the language and the culture. We are still short in that department, but a lot of the turnaround of physicians also plays a part in why it can get frustrating when you're trying to seek care. We see other people in other places have a doctor that follows them for years and years, or a sharing of providers that just really knows them and their healthcare. Here, like what we see all the time is that turnaround of physicians who come and go so often. We never build that repertoire. We never build that relationship with someone we trust enough. And I think that's a lot of the reasons why certain individuals stop going to the hospital. They feel that they're just constantly resharing their issues and their problems, and it just kind of never moves anywhere. But a lot of it also has to do with mental health issues and our spiritual practices, where some people won't go because they think it's more of a spiritual issue, a cultural issue, and they'll seek out help from a local shaman or medicine man. And so that underutilization of the hospital and the fear behind it, there is a fear. There's still the recollections from historical traumas and what happens to my blood when they draw my blood up there. Like, we have all these misconceptions that are still very present. And so it's been the biggest thing in Zuni right now. But we're moving along. We're having more familiar face providers, whether they're physician's assistants, nurse practitioners. We are starting to see a lot more community members take upon those challenges and becoming healthcare providers. And I feel like it's bringing more easement. And the more we understand, the better questions we're able to ask also. So on the public health side, that is where I feel we were missing, is to just help people understand and break down all the things that they might be getting from the hospital. Maybe they don't understand their ailment. Maybe they don't understand the suggestions from the doctor. So that's kind of where that segue into becoming, trying to find effective ways to communicate healthcare have been slowly coming about. And lo and behold, art has been one of them. And Zuni right now, our main issues within the community, of course, have really been diabetes, kidney disease, and as of lately, cancers.
Hmm.
So we've been really driving home these ideas on preventative care and trying to educate and expand the knowledge on how you take care of yourself and your body, and the way that my art connected to the hospital and that idea was, I believe, in 2007. I hung up some work at the hospital for the people, and there are different little paintings of body parts and um, systems in our body down to the cells, just adorned with Zuni designs and motifs, but they're kind of also very technical on what the structure of the bone looks like, the animal cell, the different things. And I didn't know that at the time that a lot of Zuni community members were, stopping in the hallway, looking at these paintings. And when it was their time to see the doctor, they would ask about, hey, I just, saw a picture of the kidney in the hallway. And you said something about, my kidney health. What is, what is this? Is that what it looks like? What does a healthy kidney look like? It opened a dialogue that we didn't know was going to happen just based off of the paintings. So there has been some dialogue in it, and just like, a friend of mine, he actually approached me one day and said that it made him look further deeper into himself and to start looking at his healthcare a little more in depth. Like he felt more proud to be Zuni that day, he said, looking at these paintings and realizing that there is a cultural aspect to how we take care of our bodies and why we take care of ourselves and others. And he said that that was the beginning of the road to his sobriety. He started he quit alcohol and he started taking care of himself. And he said that he was interviewed on a local newspaper saying that, and it was really neat to see that that's what his response was when he saw the artwork. So that is where my career started in advancing these ideas and allowing the people to open this dialogue between them and providers, researchers, and academia in general.
Just a reminder that you're listening to COVID Calls, and I'm talking to artist Mallory Quetaki today. We're talking about life in the Zuni Pueblo, and we're going to turn to talking about COVID. We're just hearing a little bit about Mallory's work and how it's intervening in the public health space there. Mallory, there's one other part of the story I think we should pick up, and it's actually how you and I met, which was talking about environmental health and the nuclear legacy there. In the Pueblo. Can you tell us a little bit about that?
Well, Zuni Pueblo itself, we are more considered downwinders from the mining that's going in and around the area. The closest mine to us is the Church Rock mine, which is on the Navajo Nation. It is right outside Gallup, New Mexico, so it's about 30 miles away. However, like I said, we are downwind from it. We are along the water route that the Church Rock mine spill in 1979 happened. So a lot of that water that spilled from the dam that was holding remnants from the mine flooded into the arroyos and into the waterways all the way into Arizona. We're in that path, and we fought off a coal mine back in the early 2000s, which we won, and we're thankful that they haven't returned. But in the area of Gallup and just the greater Navajo Nation, there's thousands of abandoned uranium mines, and that the one that gets the most attention is the one at Church Rock because of the spill. There are communities living in and around there, right near tilling piles and mine waste piles, which are still being worked out through the government and through the courts on who cleans that up, when, and how. It's a lot of processes, a lot of remediation processes that are still and have yet to happen. And then our cousin community or cousin pueblo, which is the Laguna Pueblo, is also in the shadows of one of the largest open pit mines in the world. At one point, it was the largest open pit mine, uranium mine, and they are about 80, 80 miles to the east of Zuni Pueblo. But we all share in our culture and in as Pueblo people. So that the injustices that have happened in those lands is it's I mean it's a lot. There's so many things that have happened, and now that the people themselves have come to learn about the dangers and the hazards of uranium and its mine waste. There's so many other heavy metals that are involved in the mining of uranium, and some of these are seeping into areas where humans are growing or have agriculture fields, are watering their animals. There's cattle that roam freely in these lands that are contaminated on both, Laguna and Navajo reservations. And so this concern is one of the most highly controversial topics because you see both sides. Mining did bring economic growth to these areas, and yet years later we're now seeing the toll that it's taking on the people. There are higher rates of disease and cancers and other health ailments within Navajo Nation, and especially those that live in and around these abandoned mines. So we have several studies going on under the UNM College of Pharmacy. We have 3 programs that we work with. One is the longest one that's been going, which is the Navajo Birth Cohort Study. And we follow pregnant mothers and their children for up to 9 years after birth. And we look at their overall health growth by doing surveys, simple checkups. We also follow up on different, so my part in that is that I help with the eye tracking portion where we study emotional growth in children. Some of it, this program can be used also to identify autism in children and whatnot, but that study came about because of an observation that 4-year-olds around, should be able to talk and be able to carry conversations, but through another program before this, they recognized that there was a lot of 4-year-old Navajo children who weren't speaking yet or were a little, having a hard time with other things, other cognitive, normal growth functions. And so this is why we started looking into the children to see if any of these exposures are the root cause. And so we have the Navajo Birth Cohort Study. We have the Superfund Center, which is the metals program. That one looks into abandoned uranium mines and its exposures in both Navajo and Laguna Pueblo. And then we have our Native EH Equity Center, which looks into both Navajo and also Cheyenne River Sioux in North Dakota and the Crow Nation in Montana. So we look at all their mining legacies in their areas, the possible contaminants and exposures that the people may or may not be exposed to. And, our studies are ongoing and we are still collecting. And we are also, part of the little, the 3 centers that we have. My part is, not just being the artist in resident, but also helping with the idea of community outreach and allowing the people to have access to the data that we have, to have the ability to talk on their own, to approach their government officials, to approach policymakers, and they give them that community opportunity. There's some grassroots and nonprofits out there that are helping advocate for them, but we're also kind of doing the same by giving them the information they need to go out and start helping their communities with remedial processes, cleanups, and more research. And it's been quite a journey because I, to be honest, did not know half of the things that I've
Mm,
been shown in, and it's so close to our reservation. I mean, we're in Gallup all the time. The waterways are all interconnected, and it's something that I feel in for us to help with the community is we want their voice also. We just don't want the idea that, oh, it's a contaminated piece of land. Others could be like, so what? It's like, no, there's a need to know on the other end for either academic researchers, scientific researchers, and government, EPA, NIH, for them to know the importance of land to Native peoples. Majority of Native American populations, our cultural, one of our greatest core value is that we are custodial to the lands that we live on. So it's very important to us as a people to protect the land. Mother Earth is a person and not a place for us to just kind of walk in and do what we want. And so that idea and that thought of how connected we are to the lands is something that I feel that was missing in a lot of the conversations when it came to research on exposure and contamination, and the importance on why, on the other hand, why there's herds of researchers on our lands right now. There is a reason why we want them there and we need them there. So we kind of also have to balance that idea that as researchers, we can't just come in and barge in, that we also have to pay attention to cultural values and cultural
right.
protocols, and each tribe is different. So
Well, thank you for sharing that. And I mean, what you're describing. Also, there are the health impacts of being in a community with that kind of extractive industry close by, and the longstanding legacy of it. One of the real challenges of that, from my understanding, also is the uncertainty, and that goes along with nuclear exposures, broadly speaking, in other places as well. So people might not know if the health problem they're having is attributable to heavy metals in the water, or particulates in the air. So there's this mental health dimension to it as
yeah,
well. And I wonder how you see those connect. I mean, we should just turn to COVID for a second. I mean, the experience of the pandemic there in the Pueblo when it first started. You mentioned as we were beginning our discussion that there was a full lockdown. Um, but as you were also talking earlier, because it's a rural community, because there are underlying health issues and health inequalities, it seems like a community in which there would have been a lot of concern that a pandemic like this could come in. So I wonder if we could sort of talk about that aspect of it. What was it like there to manage the pandemic with all of these other things in the background in terms of health of the community?
yeah. I mean, it's just another when the pandemic happened, it was very surreal to us. I mean, as I mentioned before, the historical traumas of the past. When you heard pandemic, you heard of smallpox, you heard of the Spanish flu, and those things happened years before any of us were really around, and so it struck a certain kind of fear in the people, and yet again, there was also a misconception and a misunderstanding on what what the coronavirus really was. I was out doing collecting data on Navajo Nation in that first week of March of 2020 when I mean, it was already in the news. We heard that, New York and LA, Seattle were being hit by this virus that they were still learning about. And it was that first week in March that we got pulled out of our research trip, our data collection trip, because Tuba City in Arizona, which is kind of the heart of the Navajo Nation, they got word that they had several people come in with symptoms of COVID. And sure enough, they were positive, and it spread like wildfire from there. I was supposed to drive home to Zuni thereafter after my collection trip. And I called my mom. She was going through chemotherapy at the time, and I told her I do not want to risk this virus on you. I've been to a place where it's considered a hotspot. It's there's an outbreak. I'll tell you more on it once I learn more about what this coronavirus is. But you guys saw the news. What we thought was only in China, in the big cities, it's here. And at the same time, I told my father, who is a tribal councilman, I said, you need to tell your council that it is here, even though it's about 200 miles away into the city. I said, it's here. We can say it's here. And it took a while for our tribe to respond. I think they didn't shut down or do any precautions until April, about a month after that. By that time, we had a small outbreak at our own clinic, starting from the dialysis center. And as I had mentioned before, kidney disease, chronic kidney disease is one of the biggest diseases in Zuni. And so a lot of our people utilize the dialysis unit, and that outbreak happened there, the initial one, and it just spread like wildfire from there on. And as I like to bring up that idea of having multi-generational households, and it's seen across different tribal communities where there's several generations of families living in one household. I do know that even in one of my family members' homes, there's the grandfather, their children, their grandchildren, and then now their grandchildren are having babies, and they also live in the same household. And usually there are a couple people that leave out of town to work, and that made the spread so much more easier. There is no way to quarantine. We don't have hotels or any kind of lodging within the tribe to house that many people to quarantine themselves. So if an individual got sick, the whole household had to quarantine. It wasn't until recently that we were fortunate enough to receive through the CARES Act. I guess they procured RVs, little housing mobile units to house people to quarantine if it's just them and their families were not affected or were not positive from COVID. So a lot of things had to happen. We are a very tight-knit community. A lot of mental health issues began to sprout because we are very social. Our culture, our religious practices, we gather. There is no word in Zuni to say keep your distance or don't go near somebody, or it's don't gather. That whole idea, that word doesn't exist, because everything we do, in English we say it all the time, it takes a village. And so it took a village to not get together, and it was really hard to get that idea across, this ancient way of thinking, that we can no longer do what we normally do. And we have so many ceremonies surrounding our yearly calendar. We observe everything from the end of winter to the beginning of winter and everything in between. All the spring, the summers, we have so many ceremonies that we as a people do to keep the balance and the harmony of our spiritual world. And those things had to be either stopped or lessened and altered in a way to where it was still safe to do so. And that inability to gather and see people and to participate and to just be hands-on with the different ceremonies, we started noticing, the suicide ideations and the different substance abuse levels that just rose once the pandemic had the village shut down. We have a curfew. Before, when it was really, when COVID was in full swing, we had 6 o'clock and 8 o'clock evening curfews. Everyone had to be at home. No one was allowed on the streets. Even the certain weekends, they wouldn't really allow people to leave. You just stay home. If you need anything, contact somebody and they'll bring it to you. Designate only one person to leave the reservation. We only have 2 grocery stores in Zuni. We are a food desert, which plays in part to the obesity and diabetes rates in Zuni. Um, I think the whole idea of having to travel far to even get food, also caused different problems within the tribe. And how do we feed 12,000 people plus in a small reservation with just two grocery stores? And so that not only that, but also just the jobs, people getting laid off, and the money, and the art shows that no longer happen, the in-person selling, like it took an economic downfall as much as it did socially, mentally. Uh, we've all been impacted when as much as there is of us, when one person dies, it still affects everybody. We all know each other in some form or fashion. We are all related in some form or fashion amongst our tribes. And so, that hurt, that pain was felt. And we had to address the idea that we were not only mourning the people that we lost, but we were mourning ceremony. We were mourning our right to gather, and our right to pray, basically. And a lot of our traditional ceremony and doings have been put on hold and or altered, and it's for the elderly, especially, who are our number one assets. Was really painful for them. That is who we are trying to protect, because that is who is keeping our culture alive. We still have a lot of stuff to learn from our elders, and that's who we're trying to protect. Um, that is our biggest cultural asset right now, and unfortunately, we've lost along the way many to COVID.
Just to follow up on that, funeral practices have had to be modified in so many cultures around the world in the middle of COVID. How did you adapt there in Zuni Pueblo to the fact, as you said, people couldn't meet,
Mhm.
and yet you had to try to mark, the loss of life? How did
Mhm.
you how did you meet that?
Very heartbreaking, because our burial practices are very hands-on. We bury our own, and we have the ceremonies that happen, and those ceremonies were no longer allowed. And so, and I just want to recognize my cousin, Kali'i Eli, who is a Navy veteran. He took upon himself to reach out to the many connections he had through his fetish business, and just overall how he was able to make these connections is amazing. But he went and he procured um, biohazard suits, PPE, gloves, cleaning supplies, and he supplied households who were in quarantine with these cleaning supplies and masks. And then he went on to being able to find, bunny suits and the different, booties, coverings, face shields, head covers, to people who had to bury the dead. And in our culture, it's usually your male family members. So my cousin, was going around teaching these gentlemen how to don the biohazard clothing, and how to properly wear and dispose of it after, so they can bury their own. Because at that point, you just you received a body in a bag from the hospital. You're not allowed to open it. You never even saw your family member in the hospital. Once they went in with COVID and they passed, you never saw them again. And in our culture, a lot of our loss, there's no closure, because that's part of our process, our grieving process, our mourning process. Is we have ceremonies, and we have ways in which we mourn properly. And with this being taken away, the one thing they still let us have is that we buried our own. And yet it's just really heartbreaking for, a family to call my cousin at all hours of the night and say, how do we wear this? How do we put this on so we can bury our loved one in the morning or later today? And the work and the effort that he put in at least still kept something for us when we had to bury our loved ones, because he lost his grandmother, one of the first ones to have passed, because she got infected during the dialysis outbreak. And so he knew what he had to do, and he was sharing. And although it's really taboo to really talk a lot about death and dying in our culture, someone had to take a stance, and someone had to make sure that we were still allowed to do something, even if it was just that part. And he did a lot. And I mean, the suggestions they were for us actually goes against our religious beliefs, cremation, and we don't do that. So it really, really affected. And I know a lot of families still have no closure to this day.
You're listening to COVID Calls, and I'm talking to Mallory Quataki today about life and death in Zuni Pueblo in this period of COVID-19. Mallory, I'd like to talk more specifically about your art. You were sharing a little bit ago about the tradition of the strong tradition in families of passing down artistic knowledge, and you said come from a family of jewelers, and that didn't work for you. You're a visual artist. I'd like to, so I want to show some of the work. I'll bring it up on screen here for a second while I'm getting ready to do that. Maybe you could just tell us a little bit about how your technique is different, how you approach the artwork, and specifically, you are a public health educator through your artwork. And so there's a lot going on here. Could you set the stage for us a little bit to understand your artwork?
Yeah, well, coming from a Pueblo community, and it kind of goes the same for a lot of other Native tribes across the country, we're visual learners. We like pretty things. We like looking at, just robust color, bold colors, design, and a lot of motifs and designs that you see that I use have meaning, whether they're pottery designs or whether they're weaving designs. There's a meaning behind all of them, and there's symbology that we use constantly. And so I like using those ideas, whether if I'm painting or not, which is my main um, my main style is acrylic painting. I like using acrylic on wood and or canvas. The most recent technique I've been using, and I'm still learning, is digital art. There's quite a bit of a learning curve to it, but I've been trying really hard because I can put words on this, whereas in an acrylic painting, I try not to put any wording on it, and instead let the art speak for itself. But with the posters that we started creating, and like I said, it was kind of by request, that, hey, the CDC did release these infographics and these guidelines. However, we're just like, a lot of people are looking past that because it has no effect to them, because there's nothing relatable on it. There's no, hey, let's bring them in. How do we, bring the rope closer to them to actually see what we're trying to convey? And of course, they said we need to indigenize these CDC guidelines and these posters. And so that's where the COVID response PSAs began. I basically took what CDC was releasing and used their guidelines to create awareness. And a lot of the posters that I created, though, are however kind of more directed towards Pueblo communities, because of how we had mentioned that close-knit society where everybody does something together. So using the idea of the culture and then the imagery that and the idea that we have to be positive. We don't want to, a lot of the complaints coming from the community, especially when it came to the door signs, they said that, oh, it's just this piece of paper with a big old red wording, or yellow paper with the black warning symbols saying, do not enter COVID-19, quarantine or something really negative, and they said we don't like negative, and that is it's a cultural protocol. We try not to bring up negative subjects beforehand. We kind of ease our way into it. So they wanted more brighter, more lively looking posters for such a dark time in our life. And so,
Right.
yeah, these posters were created to make sure that we still see the beauty every day, regardless of what's going on around us. And that's kind of who we are as a people. And
I,
so,
I I love that statement you just made. It's time to indigenize these CDC posters and make them real
yes,
for our community. I'm going to show
yeah,
a few of them if you don't mind.
yeah.
I've got one up here on screen. Maybe you could tell us some of the things we should be looking for in these posters to understand how they've been indigenized.
Yeah. So, as we said, that the whole social distancing issue is really hard to comprehend for the people. So, we're just trying to tell them being apart is only for a while. And we're using the separations of cloud designs, because clouds move along and they still come back. So
Mm.
we're kind of taking that idea. The bottom and top designs are clouds. The the arrowhead is like a symbol for strength. So it's like, we're strong and we will remain strong, but being apart, we have to do it, and it's only going to be for a while. So we're taking these ideas and using, throwing in little cultural aspects so that,
Mm.
they remember. And something like this painting here, or this digital print, the three symbols, the circle symbols on the left, are all kind of like medallions, designs that are important in each culture. So the top left one, the medicine wheel, has a lot of significance to the plains tribes in the north. So the Sioux, the Lakota, Crow, um, those tribes have the medicine wheel has an importance to them. Each color means a different thing, a direction, and pretty much morals and core values. Um, the middle symbol is a picture of a Navajo wedding basket, and
Mm.
that in itself too has designs in it with meaning about how you live your life, and the harmony between the night, or the sky and the ground and one another. The bottom motif is my rendition of a Zuni sunflower painting, which the resilience of flowers and florals. They bloom every year. We know they're there. We know they're resilient. And so just that idea of regrowth and coming back um, to our ways. And of course, you see the arrowheads pointing at the COVID, the
Right.
coronavirus itself, trying to fight it off. And so that's kind of the idea behind that. And the colors, red, turquoise. Turquoise is one of our most you could call it a holy color to both Pueblo and Navajo tribes. It's a very recognizable color around here.
Well, there's so much happening here, and even as you're describing it, I'm learning, not familiar with these different motifs, for example. So this is carrying a lot of cultural power in this
Yeah.
organization of images you have on the left, and then on the right, it's language that we've all become sort of used to, help our fight against COVID-19, or this idea of the social vaccine, protecting relatives. But this enriches them. I mean, this makes them personal, and
Mhm.
uh, I wonder what kind of feedback you've been getting about these.
It took me a while because I was, going through my own mourning processes, both losing family, friends, and my mother to, she didn't pass from COVID, but she succumbed to her cancer last year. So it kind of took me a while to get the ball rolling. And no one was pushing me to do any of this, but once it came out, there was like, oh, finally, okay, we knew you're gonna make something like this, and we were just waiting because people are seriously just walking past the ones we download from the internet, the ones, the facilities, the hospitals, or like I said, the CDC are sending to us. It's infographics that make no sense to them
Right.
because there's no cultural connection. So they're not stopping to actually look at it. But if you're putting on
Right.
like, these images we know and we love, we're gonna stop and we're gonna look at it. So we're gonna hang it up with pride. And that's the thing, is that it's more pleasing to the eye, and as does it portray that the importance that we need to keep ourselves safe, we need to protect others.
I'm sorry to hear about your mother, and I hope you're finding some peace with that, um,
Yeah, it's
and making art through that time.
it's
Um,
been
hard to get started, but maybe, I mean, based on the output, you've found a way to work. I mean, each of these posters, I can only imagine how much time it makes. This one's interesting because it has this motif of the masked healthcare worker right in the center.
hmm Yeah, it's as if, we're, the fight is there and here is proof. This basically she's asking for our help,
Mm.
to make sure she doesn't see any of us on her, on her unit in her beds, having to help um, from the COVID disease or the virus.
Now, this one addresses some of the issues you were talking about with social isolation and
Mhm.
how that might have a particular resonance there in the Zuni Pueblo.
Mhm. Yeah, this piece was actually requested by a behavioral health group that actually I joined not too long after this. It's a working group that we created, to where we're trying to reach out to local communities, tribal communities, on how to keep your mind healthy during this time. And like I said, I use um, the idea behind the medicine wheel, because each color and each direction has a different meaning. So there's colors that refer to like your body, your mind, your spirit, and like what you do on a daily basis. So those are all broken down in within that color wheel. And
Mm.
so a lot of tribes are able to kind of connect that to that overall knowing. There's a term called indigenous ways of knowing, that it's shared through, it's I don't want to call it universal idea, but it is kind of a general thinking with especially with our spirituality, which is a whole lot different than some cultures. And so that ability to recognize things of that nature, things that are,
Mm.
I guess you can say esoteric, but if we say the right words or show the
Mhm.
right symbols, they'll get it, they'll understand. So that's one of those pictures, the medicine wheel.
And this one comes to this issue of, so this is a sign that's meant to be placed on a front door.
Mhm. Yes.
Mm.
We are, like I said, they said they were only getting paper. People who were on quarantine were only getting like a sheet of paper from the hospital or a command center of some sort, that incident command were giving out, just, plain red signs that said quarantine, do not enter. And so not necessarily everybody was under quarantine because they were infected. They were quarantining because they didn't want to be infected.
Right.
They're social distancing, they were not welcoming visitors. And they're saying, like, how do we do that without, these just ugly negative signs? And they said, and then we don't want to also stigmatize the fact that we're all infected. What other ways can we show that we're not
Right.
accepting visitors right now? So these signs were by request, and made them really quickly so that there was a selection. And as I said, we updated some of these to where we're writing down resource numbers, the local incident command, the food pantries. Even we're leaving blank sections for people to say, "Hey, call us instead." Um,
Hmm.
you know, so you can reach us here instead. And so we've updated a lot of these flyers.
This one, I mean, there's so many layers to this. I'm noticing the arrowheads, which are part of the fight here,
Mhm.
and it's it's true too. I mean, I think it's an important point to make. It's about um, families respecting each other's um, desire to protect their elders and everybody in the
Mhm.
house,
Yes.
which is running, as you've said earlier, really against the grain, against the real fundamentals of Zuni community values. So you do have to explain it. I mean, you do have to really sort of go that extra step. And this is a lot more powerful, I agree with you, than a sort of a generic CDC poster, which makes it seem like the government has said we're going to do this, and so I guess we're going to do it. This is very personal, feels like to me.
Yeah, yeah. It means, because there are, there are families and individuals out there who still don't quite believe that this is happening.
Sure.
They're still kind of either misinformed, or they don't get out much to actually realize what else is happening in the world, and that this pandemic is real and it's taking lives. And so for it to be personalized to their community and where they're from, it's like you kind of want to start taking it seriously once you see, the local artists getting involved. It's real. It's here.
And this is similar to the first image that we
Yeah.
looked at.
And this is the one focused on the mental health, and we put in these resources, these numbers
Right.
for people to call should they have any need to speak to someone.
I want to, so these are posters that were all produced in the last year. And I'm just going to, if it's okay, I'm going to back out of this screen, and I'll make this link available after the call so people can find it. I located this. This is your artist page, wakelet.com/@CEHP_artist. I'm just going to repeat that again. Wakelet, WAKELET.com/@CEHP_artist. And this is where you can see all of Mallory's work. And I just want to, we won't have time to go through all of them, but this is work that you made before the pandemic.
Yeah.
I wonder if you could just tell us a little bit about these, Mallory. I mean, they're so extraordinary. I think this taps back into what you were talking before, the kind of posters that people were interacting with in their when they're going to medical centers.
Yeah. This one in particular is a commission requested by MIT, the Massachusetts Institute of Technology, biochemical department, and biomedical department, I believe. And they requested an image for the Wabanaki Confederacy tribal people, which include the Passamaquoddy, Micmac, Penobscot peoples. And we call them the people of the Dawnland out east. And they're doing a study on gut microbiome. So the gut microflora and how it relates to immunity and to other health concerns. And so they wanted a way to show probiotics and prebiotics working within the gut, but on that cultural level. And so I used the beadwork motifs of those peoples up in the East Coast, their tribal designs, to create that idea of what prebiotics are. Prebiotics are that chemical oligosaccharides in the top corner right there that help, with other, the foods we eat, and the probiotics that exist within the foods we eat and that are also living in our guts, how they interact and then become intertwined and become whole designs. And that's just like the idea of how this biome works together to create, our digestive tract, whether, the healthy digestive tract.
There's one more I was hoping we could get to here. I'd love to just go through all of these, but this one has the nuclear element.
Yeah, that's the DNA damage piece. It's just basically showing what elements can harm the DNA. So you have the nuclear signs in there. You have, I believe, have symbols for arsenic, uranium, even reactive oxygen species within those. So anything that can harm DNA is in that little yellow circle. And it's basically a wrecking ball crashing into DNA, just to show that there is a breakage, there is harm happening. And just the idea, because this is what we're trying to convey when we meet communities living in and around abandoned uranium mines, and the possibilities of how these contaminants and these exposures might be affecting their bodies.
Just to follow up on this, because as you've explained it, so this is an image of great violence. I mean, this
Yeah.
is, as I see it, I mean, this is the disruption
Mhm.
of DNA strand because of nuclear exposure,
Mhm.
and that disruption. I mean, there's something quite terrifying to me about this picture. I mean,
Mhm.
in a, and I mean that with great respect. I mean, it's really effective in that way because you don't know when that damage will manifest itself. And so
Yeah.
this is something that might be coming later in a person's life or in a community's life. Is
Mhm.
that also a tradition in Zuni art to grapple with loss or trauma?
It's not necessarily something we portray. A lot of what we portray is really positive and educational.
Hmm.
Um, so this is kind of, like I said, negativity, death, and dying is sort of taboo, and when we portray it. So instead, it's the idea like this shouldn't be a standalone painting. I always tell my colleagues that
Mm,
you always have to follow up with the whole one and the one that is regenerating the DNA repair, because there's the happy at least like a good side of the story where our bodies can repair itself. The DNA can repair itself in little ways, whether through medicine or through our natural immunities, that the different ways our bodies can heal itself. And it's this painting right here portrays just that, using the idea of a string of beads becoming
mm,
undone and just going back in and restringing it. It's gonna fix itself. And the ideas of, the motifs of flowers and reblooming, regenerating. You have to follow up with that too, because that other painting it's pretty negative. It's like really when we try not to put it as a standalone, just
right.
and it's just there to literally show that that's what we mean by like DNA damage. Like there is something happening, and it is repairable. And then that's when we can also segue into the parts that are not repairable, or
Mhm.
what other things can happen. I think art is a better segue into that conversation than verbal. We've noticed that. So
That's so interesting. And thank you also. I mean, that context is important, that that earlier image I showed should not be seen individually. It should be seen in conjunction with this one so that you
yes.
can tell a more complete story.
Mhm.
I'm going to
Yes.
bring us out of this mode and back into this. We're almost up on time. In fact, I've kept you too long. I figured I might when we started talking about the artwork because it's so profound. I mean, you've got so much talent there, and it's doing a lot of work too.
Mhm.
I wonder, just as sort of a final question here, as you're thinking about moving into this period in which the case rates are going to come down, vaccination is going up, um, how will you continue to reckon with COVID-19 in your artwork, do you think?
Um, I had a hard time keeping up with the different vaccinations. In the beginning, I only did one painting on the mRNA vaccine and just how to break that down and visually explain it for the people. And before you know it, we had the Johnson's and Johnson's one come out. We had, the other ones are now in line to be tested. And so I said, okay, maybe not so much the how this vaccine works, but now I've had a lot of requests from other communities to keep up with the importance of actually getting the vaccine, much less the how it works, because that's kind of my thing in as you saw with the other pieces, that I'm more interested, more wanting to give the people an idea of how something works, how a system works. And right now they want there's a focus and a need to talk about the importance and to clear away misconceptions on the vaccine and how to continue to keep yourself safe. And I think that's we're going to continue with the PSAs. The other website I gave you, the AAIHB, the Albuquerque Area Indian Health Board, has allowed us to feature our other PSAs. There's little videos we put together. There's an art slide of what to do with your emotions during the pandemic, your emotions during trying to convince family to get vaccinated or to quarantine. We're starting to think more along the lines of behavioral health. So I'm going to keep up that momentum in that direction, and we'll go from there. As of right now, though, with things kind of easing up a bit, we can actually start probably doing things on reflecting what we learned and what we now know and how we move beyond this. So, but it's going to be nice to put on that mental health awareness portion to it as well.
I'm just putting up here on the screen, and people can find the aaihb.org website to find out some more about the issues we've been discussing here, and then the link also to Mallory's artwork, where you can see those posters and paintings that we've been discussing here. So we're up on time, so I just want to remind everybody that you've been listening to COVID Calls, and you can catch COVID Calls most weekdays at 5:30 p.m. Eastern Time. I'll be talking with David Nunez tomorrow, who's the technology director for the MIT Museum, and I know many of you have been reading his blog throughout the pandemic's spiritual computing. I hope you'll join me for that discussion tomorrow at 5:30 with David. And Mallory, thank you for this gift of time today and explanation and going through so patiently and talking about the history and also the artwork. All I can say is keep doing this extraordinary work you're doing.
Thank you. Thank you for having me.
Stay healthy, everyone. We'll see you tomorrow at 5:30 p.m. Eastern Time.